The human body is incredible at adapting. Even after years of pain and weakness, you can build strength again. With patience, consistency, and the right sequence, your muscles will respond. Are you ready to get back to the activities you love after knee replacement? Well, we're here to talk about what really works. The Total Knee Success Podcast is your trusted guide before and after total knee replacement. Here you'll find practical tips and evidence-based strategies, not personal medical advice, just education, all to help you manage pain, rebuild mobility, and get back to living the life you love. Let's dive in. Hey, welcome back to the Total Knee Success Podcast. I'm really glad you're here today because we're talking about something that makes a huge difference in how you move after knee replacement, and that's strength. After surgery, your muscles, especially your quadriceps, those big muscles on the front of your thigh, tend to get weak. And that weakness is a big reason why walking, standing up, or going downstairs, among other things, feels harder than you might have expected. Does that sound familiar? But here's the encouraging news. With consistent exercise, you can rebuild your strength, improve your stability, and take pressure off your new knee joint. By the end of this episode, you'll understand 3 key things: why quadriceps strength matters most, how strengthening actually works step by step, and what practical timelines and exercises research shows are most effective after surgery. Before we get into how to build strength, it helps to understand why it matters so much after knee replacement. Think about standing up from a chair, walking without shuffling, or stepping down a curb. These are movements we often take for granted before surgery, but right afterward, weakness in the quadriceps can make these everyday movements feel much more difficult. And maybe you did have difficulty with these movements before surgery because of your knee pain and knee arthritis. And this isn't just a small dip in force. Well-designed studies show the quadriceps can lose up to about 60% of their strength right after surgery, and it takes time and targeted work to bring that back. Swelling adds another layer. Even a small amount of joint fluid can turn down the volume of the quad, a nervous system effect called arthrogenic muscle inhibition. You're trying, your brain is sending the go signal, but the muscle doesn't fully fire. If you've ever felt like you're pushing but your leg won't cooperate, you're not imagining it. Researchers have studied this pretty closely, and they found that when fluid builds up inside the knee joint, receptors in the joint capsule actually send signals to the nervous system that dampen the quadriceps response. In some studies, adding just 20 to 30 milliliters of fluid, and that's only a couple of tablespoons, was enough to reduce quadriceps activation. And that means you can be working as hard as you can, but the muscle is essentially shut down until the swelling eases. It's one of the big reasons why early control of inflammation is really so important. Now layer in normal age-related changes. Yep, I said it. Age-related changes. Beginning in the 50s, research shows that muscle strength starts to decline at a steady rate. In the 60s, both muscle strength and muscle mass may drop about 1 to 2% per year, and by the 70s and beyond, these losses can accelerate further. Over time, this reduces the reserve you rely on for balance, endurance, and independence. And if you've been living with knee arthritis for years before surgery, you've likely lost additional strength simply because of pain and disuse. It's hard to keep muscles strong when every step hurts. And here's the kicker: those years of pain-related weakness add up, leaving you starting from an even lower baseline after surgery. But hope is not lost. The human body is incredible at adapting. Even after years of pain and weakness, you can build strength again. With patience, consistency, and the right sequence, your muscles will respond. And every bit of progress makes daily life more natural again. And here's something really important. Of all the muscles that support your new knee, the quadriceps are the most critical to strengthen. Multiple studies have shown that quadriceps strength is the single best predictor of how well people walk, climb stairs, and function after a knee replacement. In fact, one large study found that patients with stronger quadriceps 6 months after surgery had better long-term mobility and less disability years later, compared to those who remained weak. That's why so much of the rehab process focuses on getting your quads back online. because they directly drive your ability to stand, walk, and handle daily life. Let me share a quick story that shows why strength is so important. I recently worked with a patient about 7 weeks out from his knee replacement, and he was frustrated because his quads weren't firing the way he wanted, and he still couldn't straighten his knee all the way. We started with some simple quad setting exercises, and to give his muscles a boost, we added electrical stimulation, and that extra cue helped his brain and his quads reconnect so he could finally activate the muscle while holding his knee straight. And within a couple weeks, he noticed a real difference. His leg felt more dependable under him, and his steps got smoother. It wasn't a magic fix, but it was a turning point, because once the quads started firing, everything else became easier to build on. Now, let's talk about what strengthening really means. Many people assume that simply moving more after surgery will rebuild strength, but that isn't quite right. Walking and stretching are valuable, but they don't load the muscles enough to make them stronger. Strengthening means asking a muscle to do more than what it's used to, just enough extra challenge that the tissue has to adapt, and then giving it time to rest so that adaptation can occur. At first, that challenge may look very simple. When you tighten your quadriceps with your knee straight and hold the contraction, that's an isometric exercise. The muscle is producing force, but the joint isn't really moving. A common example is sitting with your legs straight and pressing the back of your knee gently into the bed or the couch or the table at your therapy session. As your quadriceps begin to respond more consistently, you'll progress more into isotonic work. And isotonic just means the muscle contracts while it lengthens or shortens. An open chain example would be a straight leg raise where your foot moves freely in space. A closed chain example would be a sit to stand from a chair where your feet stay fixed while your body moves. And both types of movements are valuable. Open chain tends to isolate the quadricep more directly, while closed chain patterns train groups of muscles in real-life movement. Now, let's talk dosage. Guidelines from the American College of Sports Medicine emphasize that muscles typically get stronger when you work them for about 8 to 12 repetitions in a set, repeating that for 2 to 3 sets. And the last few reps of each set should feel challenging but still controlled. That's usually the sweet spot where the muscle is signaled to adapt. But here's the part most people don't realize. The rebuilding doesn't happen while you're exercising. The signal happens during the work, but the actual adaptation, the muscle fibers becoming stronger, takes place afterward, during the rest period. And that's why pacing is just as important as effort. Doing strengthening work every single day without rest doesn't allow your muscles to recover and rebuild. And remember, this is the framework, not the prescription. The specific exercises, timing, and resistance should be chosen by you and your therapist based on where you are in your healing. Early on, isometrics may be enough. Later, isotonic and closed chain work with progressive resistance will be introduced safely under guidance. So when you hear the word strengthening, think about this cycle: activation, controlled movement, added load, recovery, and all that with gradual progression. In the first few weeks after surgery, your North Star is activation and control before resistance. You're teaching the quadriceps to switch back on cleanly and consistently, and this adaptation tends to be neurological in the beginning. It's getting the right muscle fibers to fire. And this is the time for simple, focused work. Quadriceps setting exercises or firm squeezes with the knee straight. Straight leg raises while keeping the knee fully extended and not letting the foot lag toward the floor. Gentle heel slides to keep motion coming, and short, well-controlled mini squats or sit-to-stand practice from a higher chair. At this stage, the focus is on making sure your quadricep activation is sufficient and progressively getting stronger before you add resistance. And a stationary bike can absolutely help, but at first, it's a gentle tool for range of motion and rhythm. Resistance is a later thing. Your early wins are clean muscle activation, calming the swelling, and a steady gait pattern, even if that pattern is slow. So quick pause. How's your leg doing today? Can you tighten the quad and see your kneecap draw slightly upward toward your thigh? Can you lift the leg straight without the lower leg lagging down and creating that slight bend at the knee? Are your steps getting a little smoother? Take a breath and recognize those small wins. They're proof that your hard work is paying off. This is a common question that I hear. When can I start using machines or weights? The honest answer is it's not a date on the calendar, it's a criteria-based green light. Here's what that green light usually looks like when you put it into words. You're walking comfortably without a cane or walker on level ground. You can perform a set of straight leg raises without a lag at the knee. Swelling has quieted, and it's not gone forever at this point, but it's not flaring up with just regular daily activity. And when you contract your quad, it fires promptly and holds a contraction without shaking. For many people, that sweet spot shows up somewhere between 6 weeks and 12 weeks. But there's a lot of normal variation. Some folks arrive a little bit earlier, others need more time for the knee to calm down and the muscle to wake up. And it's important to note that some surgeons explicitly state not to add resistance before 6 weeks. This is where good communication with your surgeon is essential. And if you'd like more on how to approach these conversations, check out episode 6. Now, let's connect that to healing timelines. In the first 2 to 6 weeks, the main focus is calming swelling and protecting the incision. From 6 to 12 weeks, tissues remodel and the bone around your implant heals further, which is when light resistance can often begin. Between 3 and 6 months, your muscles become more responsive and you notice bigger strength gains like easier stairs and longer walks without having as much soreness. By 6 months to a year, strength and endurance continue to build, and more advanced activities become possible. The takeaway is simple. Healing and strengthening run side by side. Early on, the tissues just aren't ready for big loads, but as they heal, your training can safely progress. Respecting that rhythm helps you build strength without having setbacks. With consistent effort, meaningful strength gains often appear between 8 and 12 weeks, and strength building can continue for close to a year. This process isn't instant, but steady efforts bend the curve in your favor. So let's get real here. If you pick just one muscle group to strengthen after knee replacement, it should be the quadriceps. And you shouldn't only pick one muscle group, you should be strengthening all around. But know this, the quads are central to standing, walking, stairs, and daily mobility. Research consistently shows that postoperative quadriceps strength is a critical predictor of functional outcomes. As one EMG study showed, even simple home exercises like banded knee extensions or bodyweight squats often activate the quadriceps more than machine-based work early after surgery. So if you do no other strengthening, make sure something similar to these exercises are in your plan. Isometric quad sets, sitting or lying with the knee straight. Tighten the quadriceps and press the back of the knee gently into the bed, holding for 5 to 10 seconds and repeating for 10 to 12 times. Some studies even show early isometric work with feedback may improve pain and perceived function. Next up is short arc quads with a bolster or a roll towel under the knee so it's slightly bent, say maybe 20 to 30 degrees. Lift the foot slightly off the ground by straightening the knee a little and then return. One study showed that knee extensions with elastic bands produced higher voluntary quad activation than machine extensions. That's good to know. You don't always have to have a machine. And then last but not least, body weight sit to stand or partial squats, which is a closed chain exercise. From a chair, stand partially or fully if you tolerate it, then sit back down slowly. In the same EMG study, sit to stand and one-legged squat, which is a pretty advanced exercise, showed high quadriceps activation compared with leg press machine. Easy does it on the one leg. That's definitely more challenging. For a basic minimal quad program, aim for 8 to 12 reps per set, 2 to 3 sets, and that's done 2 to 3 times per week with rest days between. The rest days are very important. These exercises are often safe to begin when your surgeon and your therapist agree, especially once you have reliable quad activation and minimal swelling. And I will make a comment here. It's probably not your surgeon who's going to be having this conversation with you. This is really a physical therapist conversation. And I want to emphasize doing only these minimal exercises is not ideal long-term, but they do provide a fallback so you maintain some quad stimulus, even if you can't access a full gym or equipment. And over time, your therapist should help you expand into more resistance, coordinated movements, and higher level control. A few signs mean it's time to pause and check in with your care team. Sharp joint pain that's clearly different from normal muscle soreness is one. Swelling that keeps building instead of calming is another. And if you suddenly lose an ability you had last week, like lifting your leg or walking steadily, that deserves attention right away. Normal muscle soreness feels more like stiffness or a dull ache and usually improves within a day or two. Swelling that worsens or sudden functional loss are not normal. Knowing the difference keeps you safe while you strengthen. So here's the big picture. Strength comes back when you respect the sequence. First, reconnect the brain-muscle link and calm the knee. Then, build consistent control with body weight. After that, layer in resistance using clear symptom-driven checkpoints instead of a rigid calendar. That order protects your joint and makes every rep count. Since electrical stimulation can be such a powerful tool in helping the quadriceps switch back on, we'll spend an upcoming episode digging into how it works, when to use it, and what you can realistically expect. We'll also be doing a future episode on prehab, the preparation you can do before surgery. If it's started far enough ahead of your scheduled knee replacement, prehab usually includes some targeted strengthening, and it can set you up for a smoother path once surgery is behind you. If today's episode helped you, subscribe, share it with someone preparing for surgery, and check out TotalKneeSuccess.com for additional resources. And remember, this podcast is for educational purposes only and not a substitute for medical advice. Next time in episode 10, we'll bust the biggest myths and misconceptions about knee replacement healing. And thanks for listening. I'll see you next time. This podcast is for educational purposes only. Visit TotalKneeSuccess.com for more resources. Follow the show and share it with a friend. Your total knee success is already in motion.